Thank you, Minister. Minister, is there a realisation within government that the HSE's contact tracing system is just not working? While the HSE is trying to bamboozle us with their mean and median figures for positive tests, negative test results, for the performing of the actual tests and for the contact tracing, 8 different figures. The reality is that the disclosure of medical results to employers rather than employees was, I believe, to cover up the fact that the contact tracing system is just not working, a point which I made here in the House to the Minister for Health last Thursday. From my limited data, in about 2% of people tested, there is no test results. It is taking 3 weeks for the HSE to inform people of the fact that their sample has either been damaged, it has been lost, or that they have been unable to read it. So, Minister, there are many instances where people in receipt of the COVID-19 illness benefit for the maximum 2 weeks pending a COVID-19 test result have had to seek an extension of the payment because the results were not back and had not been retested or had to be retested. Can you indicate the numbers that have looked for that particular extension? Secondly, Minister, claimants who are asymptomatic COVID positive, that is, those who are showing no sign of infection, are eligible to receive the COVID-19 illness benefit payment for up to 14 days. But what I want to know is how many of these specific claims are in payment for less than 2 weeks. The reason that they're in payment for less than 2 weeks is because the claimants' screening in the nursing home and in the meat plants had to wait 5 to 7 days, or even up to 13 days in one instance, to get the result communicated to them. Minister, you might wonder why I'm asking you this specific question. The reason is that in the case of the person that had to wait 13 days for a positive result, who worked in a large nursing home in the east of the country, they had to self-isolate for 1 day before returning to work. But amazingly, the HSE still have no plan to retest the residents or the employees in the nursing home in question. How can we eradicate the COVID-19 illness benefit payments when such actions are currently being taken by the HSE?
I'd say thank you for the good wishes and the compliments that you gave me earlier on, but I'm very glad that I have no responsibility for the public health response or the contract tracing. Obviously, the people who were here yesterday are the people that you probably should have answered those questions to. But with regard to the payments, first of all, there doesn't need to be an extension because the law currently allows people to self-isolate for 2 periods of 2 weeks, which is a total of 4 weeks. So you don't need to apply for an extension, you just need to keep giving us the certs. And with regard to people who are asymptomatic, for as long as they are isolating, as long as their GP sends in the certs with the category unfit for work due to COVID, we will continue to keep looking after them. And there is no limit on the amount of time that somebody can be sick for COVID because, as we know, different people recover in different ways, and it affects obviously people, some people very mildly, some people unfortunately not so. So there's no length of time, or there's no cut-off time that we can keep people on it. But what I'll do actually might be interesting is to get you the data of the people and the numbers of people who have applied for illness because of self-isolation and the people who have applied because they're actually not well.
Thank you, Minister. The reason that I flagged this with you is that you have raw data within your department that could be of use to government in clarifying the absolute failure of the HSE in terms of the contact tracing system, which is just not working.